Yeah.
Yes. Before I start, what language are you all guys comfortable with?
I think we're comfortable with English.
Oh,
English should be fine. Yes, thank you.
So as introduced, my name is Dr. Romana, and I'll be taking you through general awareness about cancer as per your request. One of the wellness facilitators for Jubilee. My partner will not be able to join us today, but I believe we are going to have a chit chat and get to answer the questions and the worries that you have about cancer. And I'll just go ahead and start a simple presentation, and then I will allow questions after. So you can just jot down the questions that you have. And after the presentation, we're going to have questions and all the doubts, the myth, and everything that you have about cancer. And I'm sure we're going to get to the bottom of everything. So to begin with, we need to understand that all living things are made up of smallest structures of functioning units, and we call them cells. This is what everything that you see on yourself, your skin, salivas, and everything is just a makeup of these small cells, and they normally grow. By growing, that means every day or after some time, there are changes that make sure you keep looking the way you look. From the way you were young until the older age you get to, you will notice that you get different. That's why we have people who have smooth skin when they are still young, and then you get wrinkles when you get old. This is because this normal growth is there, and simply it is a cycle that is making sure that you are who you are. Your skin looks the way it looks, and there are times that it gets that the cells that were alive, they will die, and new cells will grow and replace the worn out cells, or the cells that are tired. So if this process goes well, the division goes well, and nothing is interfered during all this process, then you're okay. But then what happens is that sometimes an abnormality can occur during this, how should I call it? This growth and maybe division of cells. Now, once an abnormality occurs and then it is uncontrolled, that is, let's say your normal skin cell is supposed to divide maybe 8 times for you to be who you are. And then it comes to a point that it divides 16 times at once. So this is an abnormal one. So it is a multiple, it has multiplied twice the way it's supposed to be. And on top of that, it is uncontrolled. So if this happens, this is where now you say a problem has occurred, and either a swelling will be there, or maybe it will spread to other organs. And this abnormal growth now, or abnormal division of cells that we thought that was supposed to be normal, when it's not happening, that is where we say now we have what we call, that is what is called cancer. So it's simply an abnormal division of your normal cells or normal makeup of you, of any organ of your body. It could be a bigger organ, it could be a smaller organ, but everything as it's supposed to be, it's not well divided, then that is where we go to cancer. Of course, this PPT only shows the different numbers of cancers and colors that we use because of different types. Now we have the risk factors for all types of cancers. These are risk factors for any type of cancer you've read about, or you've had someone, a relative or friend who has suffered or who was deceased because of cancer. The first and foremost that is the leading risk factor for cancer is tobacco smoking. So tobacco and smoking in general is the leading cause of any type of cancer worldwide. which is followed by diet and obesity. By that is the things we eat. Nowadays, some of us maybe probably because of the way the change in the world and everything, change in life, we feel like maybe the type of food that we eat, mostly maybe they could be food from the supermarket, the preserved foods, and more or less of the natural or the food that would get maybe straight from the shambas and all that. But also sedentary lifestyle, when you're too relaxed, no activities are done, occupational exposures. This is mostly to people that it will be more of a concern to people who are working in places, maybe factories, or even part of us, the medical personnel that maybe probably are working in places like offices like X-ray offices. So this is, or some of people who are exposed to occupational cause, the matchingers, the people that are working under the sun for a long time without sunscreen or any protection on their skins. So we have family history. This is where if there is any history of cancer in the family, it's always you'll be in a risk of getting that type of cancer, most likely. Viruses, and here we talk like, for example, the cervical cancer for women. This is caused by viruses. Part of the cancer, esophageal cancer can also be because of viruses. There is perinatal or factors of growth. We know that there are some cancers that are due or because of age. The more you age, the riskier it is for you to get the cancer. For example, prostate cancer for men. Alcohol use, socioeconomic status, and here we talk of more, we say people who more high economically with a high socioeconomics. These are the ones that will have sedentary life, will be so relaxed and all that, will eat that are not so healthy, so they are more at risk of getting cancers. Pollution, this is for the people, for example, let's say in the rest of the talk of people who stay around maybe Wazo, they're near a factory, and because of the pollution around there, it would cause or put them at a risk of getting cancer, UV radiation. We go back to the matchingers, or anyone who stays under the sun for a very long time without any skin protection, whether it's sunscreen or wearing protective clothing. Drugs and medication and procedures, for example, nowadays we have, some of us would say, I as Dr. Romana, that I don't want to look old, so I'll try as much as possible. We have women who are using hormonal replacement therapies to keep looking young. So the exposure to these these hormones could actually put me at a risk of getting cancers. But then salt, food additives, and contaminants is also another risk factor in that order. And of course, this just shows how much it affects, these risk factors affects us in terms of gender, as in gender-wise, and women and men. And like you could see, tobacco is just still #1 for both men and women. When it goes to #2, for men is lack of fruits and vegetables. For women, the biggest cause is overweight. When it comes to occupational hazards, it's for men is #3, where for women is #3 is infections, and that is where we go back to viral infections for them getting survival men. When for women, it's exposure to sun and sunbeds. #5 is overweight for men, and lack of fruits for women, while exposure to sunbed is #6 for men, and alcohol is #6 for women. So we have preventions for cancer. How do you prevent yourself or lower the risks of getting cancer? And this is generally for all. We have the primary preventions, where we talk of vaccination, like for example, the cervical cancer. Now, this is only for, that's why you've seen even the campaigns in our country, This is supposed to be given to children at the age of 12 years, and girls at the age of 12 years. And this girl has to have not put herself in a position where she's had sexual contact. And it's the reason why adults, women, grown women are not given this vaccination, because it can only be given to a person who has not had sexual contact yet. Of course, we have the use of safe practice sex, which also goes to preventing the virus, the immune system, avoiding radiations, and reducing alcohol. All these are the primary preventions that if you follow them, if you go by them, it will put you under a lower risk of having cancer. Reducing alcohol, this is always a very hard topic to tell people, especially those who love alcohol. And this is because when we talk of reducing alcohol, we'll have people who will ask you how much alcohol you're supposed to take. So in the reduction of alcohol, for example, for a day, a man is not supposed to take more than 2 bottles of beer, while a woman is not supposed to take more than 1 bottle of beer. When it comes to wine, a man can take up to 2 glasses of wine, while a woman has to take only 1 glass of wine a day. And when it comes to whiskey, it's supposed to be 2 shots of whiskey for men and 1 shot of whiskey for women. So that is a day of how much alcohol a woman, someone has to take, especially for those who are having alcohol. So, if you remember, I said there was also a familial cause or risk for you to get cancer. This is the only part of you that you cannot change, actually, because you cannot change who you are. You cannot change the strain of your family. So in most cases, if there's already cancer in your family, there's nothing you can do about it. The best is maybe try to make sure that you screen time to time to make sure that you catch it when it's still early. And this is where we go to the secondary preventions of cancer, of any type of cancer. So the first and foremost is screening methods. We have either you're screening because there's a family history of cancer, or you're screening because you're at the age that you're supposed to be screening. And here we have, for example, for prostate and breast cancers, for men, prostate cancer, we're supposed to screen from the age of 45 and above. If you have no family history, from 45 and above, you're supposed to be screening at least even every 2 years, you screen once. Breast cancer, for those who don't have any.
Doctor.
Yeah.
I'm sorry, doctor. It's a bit difficult to hear you. Could you please put yourself closer to the mic? Sorry to interrupt.
No, it's okay. You still can't hear me?
Yes, you're still faded a bit.
Yeah. And there?
That's good.
Oh, okay. So sorry about that.
It's okay.
So we have a visual and naked eye scope. That is, some of us would actually notice something on our bodies and just ignore them. Sometimes, of course, maybe it could be nothing, but then if it's something that you really are not sure about, I would rather advise that you really just you go to someone who's gonna give you assurance. For example, we had a lot of people who had skin cancers, and maybe they just started with a simple spot that they just ignored. They felt like this is nothing, or it's just some alama imetokea and all that. So these changes you see, any sort of swelling and something like anything that is abnormal on yourself that you could see on with your own eyes, it's always very, very best to make sure that you take it to the attention of a doctor or someone who will help you make sure that it's nothing. Of course, we have screenings like for tumor markers, and this one we always do it for those who have family history of cancer. genetic screening, it's not that much, of course, in our country, though to the developed, this is something they do, especially, and if is someone who is not sure about their family history, they will just do a genetic screening and check if there's anything hereditary in their genes to make sure that they're at the safer side. Causative organisms, so this is just screening for HPV. This is for women, and we start at the age of 35, screening for HPV to avoid cervical cancer. Radiological screenings like mammography and x-rays and CT scans. All these are sort of screenings that we do to make sure that we are okay and at a certain age. Of course, like I said, for breast cancer, if there is family history, then screening starts at the age of 20 so that we catch it early, or if anything, we treat it as early as possible. But if you've no history of breast cancer in your family, you can start as from the age of 35, and you can be doing it every 2 years. And then once you're 60 and they've never caught anything, you're not supposed to continue with the screenings. And this goes to almost every type of cancer. After the age of 60, we always believe that if there was anything, then it will not happen anymore. And then we have the tertiary preventions. This is the early diagnosis and treatment. That is if you follow well the secondary preventions, where we have the surgeries and radiotherapies and chemotherapies, all these being the management of cancer once it is caught. Either it's early or even if it's a little bit late, but this is what they will do. Now, I'm just not that we have, and these are the most common cancers that are really in Africa. So we have the breast cancer. Now, breast cancer.
Doctor, sorry, you've started breaking again just now.
Can you hear me?
Yes, now I can. But...
Oh, I don't know what's wrong with my speaker. Maybe there's that in it. I'll look at it after this.
Okay. Okay.
So we have breast cancer, and as much as most people breast cancer is just in females, actually we also have cases, a lot of cases of breast cancer in males as well, and it has been researched and found out that at least 1 in 1,000 men can get breast cancer. Of course, women are more at risk, but then it's important to understand that even men can get breast cancer. The causes are just the same. The risk factors are the same. Alcohol use, having genetic mutation for breast cancer, and this would be if there's family history of cancer, then even a man can get breast cancer if there's family history of breast cancer in the family. Aging, chronic liver disorders. So if you have other disorders like of the liver, you might be at a risk of getting breast cancer. Hereditary, of course, and excess body weight for all. And for female, it's the same risk factors, but then for female, we have put them in modifiable and risk factors and non-modifiable risk factors, where in the modifiables, we say these are the things that you can actually do something about it to put you at a lesser risk of getting cancer. Number one being body weight. We can always make sure that our weights are ideal for our heights, so we are at a healthy weight. Our physical activity, making sure that we are at least active, not being all relaxed the whole day. Reduce alcohol use, stop smoking, reduce exposure to hormones, for example, pills, some that are getting, IVF, some, like I said, those who are using hormonal replacement therapy so that they don't look old, like clinipium. Breastfeeding is also very important to help a woman to lower the risk of getting cancer. And radiation exposures, if these are worked on well, then you put yourself at a lesser risk. Of course, we have the non-modifiable risk that there is nothing you can do about it. The fact that you're a woman and you're aging, you might be at a higher risk. the fact that there is a person with cancer, or you had another type of cancer yourself. Let's say you had maybe lung cancer, it was treated. There's always that likeliness or likelihood of you getting breast cancer, because sometimes those genes might have, those cells might have traveled even in their smallest amount and were just seated waiting for you. And then anything that happens. We have early menstruation and late menopause. Most of the women or girls that start menstruation at earlier age means that their body are exposed to their own hormones at a very early age. Now, if you start at early age and then unfortunately enough, you also get menopause at a later age, that means your body gets exposed to so many of these hormones for a long time. So they put you at a risk of getting breast cancer. Of course, there's breast density. We say most women that have bigger breasts at a risk of getting breast cancer and breast conditions. This is when you have a lot of issues that concern your breast. You maybe during as you grow up, you've gotten a lot of breast diseases, breast abscess, mastitis. All these sorts of breast conditions might put you at a risk of getting breast cancer. This is just a link. So once I share, you'll be able to also, once I share this with you, you'll be able to go through the link and learn. This link will just show you as an animation of what will happen. We also have cervical cancer, which is normally because of, it's a viral and sexually transmitted. Unfortunately, men can give us and they will not get any effect. So they just are carriers of these viruses. And that is why we say any woman with multiple sexual partners would be at a higher risk of getting cervical cancer. Having more number of children, of course, this does not mean having more number of children directly puts you at a risk of getting cervical cancer. If you're both, you and your partner are both faithful to each other, then that's not a problem. But you put this in a context that maybe probably you have a lot of children, either with different fathers. So that also means you have multiple sexual partners. But also you have that context of that if you have many children and your partner is unfaithful, this also puts you at a risk that because if you have many children means you have the sexual contact is often, and if one of you is unfaithful, then you're at a risk of getting cervical cancer, because it's highly probably that he will bring you the virus. Early marriages goes to the same. The fact that you'll be exposed to sex at early age, and probably this person is not faithful. Family history. If there is family history of cervical cancer, you are most likely to also have cervical cancer. Smoking, oral contraceptive pills, and this mostly is for those who are abusing the use of emergency contraceptive pills, the famously known as P2. We have people who take P2 almost every month, but then you're actually advised to take P2 4 times a year. So you can just evaluate yourself and see how much you have abused P2s, unprotected sex, and early child birth, which also just exposes you to early sex. What are the signs that someone will have for a woman who has cervical cancer? We have the swelling of the legs with no any other reason that would explain why your legs are swelling. Chronic backache, which also has no explanations. Spotting after sexual intercourse. Discharge that is a little bit foul smelling, and probably there is no any other disease that they can see when you do a little bit of investigations to see. You're bleeding when you're already at your menopause, but you still get some sort of bleeding, or you feel like you're still seeing your periods. Menstrual irregulation for those who are still in their periods, I mean not in their menopause, but then you find yourself that today if you're in your periods, you'll have blood spotting today, you'll have a little amount of blood tomorrow, you'll have no blood coming out the day after, and then you have so many blood coming out, or there are days that you don't see your your periods at all. Abdominal pain, and mostly it's always lower abdominal pain that has no explainable other source or cause of the pain. Weight loss, and here we say when you lose at least 10 kgs in a period of 1 month, when you are not dieting, you do not have any other disease, or you're not doing exercises or any form of you trying to reduce your weight, this should be an alarming. When you try, probably those who try to clean themselves by using hose pipes, when you see blood after washing or trying to clean yourself, that is an alarm. Having like menstrual blood when it's not supposed to, dizziness and fatigue, and the bloody stool, this should be an alarm to you. We also have prostate cancer for men. This is another common cancer in our country. And the risk factors, of course, is age. For those who have no history, as you grow up, you get at a higher risk of getting prostate cancer. Hormonal factors, for those men who probably, we say they were castrated, so most probably they would not be using most of their hormones well, so it will put them at a risk of getting prostate cancer. Rest, they say Africans are more at risk of getting prostate cancer compared to the whites. Genetics, that is, if you have any family history, someone in the family has had prostate cancer, that means you also be at a risk of getting the cancer. High fat diet and smoking, all these put a man at a risk of getting prostate cancer. And of course, like I said, by age, people who are at risk are mostly from the age of 40 and above to 59. Those are highly at risk, while they are at a lower risk. And those that are from 60 and above, those at a higher risk. And they say that 65% of patients that are aged above 65 or equal to 65 always present with prostate cancer. And how will you know, or what are the signs that should put you at an alarm that you're actually probably having all the signs and symptoms of prostate cancer? First and foremost is seeing blood in urine when you do not have any other disease that explains it. Of course, we have a few diseases, for example, any kidney disease might put a person at a risk of getting blood in urine. Force out your urine. You feel pressed, but then when you want to urinate, you'll have to use so much force for you to just make sure the urine comes out. Urinary problems, and being unable to urinate. We have cases where you feel your bladder is full, you even have pain, but then when you go to the toilet, you cannot really get the urine out. It's like everything is blocked. Having burning sensations from your lower abdomen to your thighs. Erectile dysfunctions, of course, this one is the one that most probably makes people think as fast as they can, but of course it comes a little bit later, so you might have issues with erecting for a man. Frequent urination, especially at night. You urinate almost every few minutes, or even if you did not take plenty of water, and this is because once you go urinating, you never actually really finish the urine because of all the complications that are already there. Feeling weary, sick, lower back pain, and the feeling sick in general. This should be an alarm for men to make sure that they check their health out. We also have lung cancer. which also just goes with radiations, exposure to radiations like X-rays. That is just an example. But then we have other people maybe working in factories that are more exposed to radiations, aging, pollutions. Like I gave an example, people living near factories. Environment, that is random gases. Right now we see we have a lot of cars and everything, so there's a lot of pollution in our entire our entire globe. Diseases, this is when we have other lung diseases for a very long time. Genetic, if there's family history, occupation, type of work you do. For example, like I said, we have an example of miners, those who are working inside factories that really are producing maybe pollution, and they're not really protected. And this is also the same as those who are exposed to silica, which is the fine sand. For example, those who are working in cement factories, tobacco smoking, and smoking secondhand. And this smoking secondhand, you know, we have people who say that I don't smoke, but then they hang out with people that smoke. That is smoking in secondhand. So it also gives you just puts you in a risk of getting cancer, the same as the person who smokes. What are the signs? In most cases, there will be chronic coughing. That is when you cough for a very long time with no any explainable disease that is causing the cough, and it's not getting better by using any sort of medications. Coughing blood when you do not have TB. Wheezing, that is feeling, the simplest way to put this is feeling kama mluzi. When you breathe in and breathe out, there's a sound like mluzi coming out of your chest. Having chest and bone pain, chest infections, all this. Hoarseness of your, difficult in swallowing, and then there's hoarseness of your voice. You have, and then suddenly you speak and it feels like sauti inaparuza. Shortness of breath, you're breathing, but then you feel like you're not taking enough breath, you're not breathing well. Unexplained weight loss, just like in the cervical cancer. Finger clubbing, this might not be something that you can see, you will know as a person, but if you go to a hospital, the doctor can assess the finger clubbing, and this can be an alarming. Then we have another one, which is the colorectal cancer, and this is the cancer of the colon, which is also now becoming one of the top disturbing cancers in our country, and frequently it's because of diet, aging, anyone 50 and above, vitamin B deficiency, lifestyle where we have the obesity, people that have diabetes, and those that have sedentary life and smoking, but other medical histories that involve your bowel. If you have any diseases, chronic diseases of your bowel, they'll put you at risk of getting cancer. And of course, most of the times, people will notice that they get a lot of constipation often, and this constipation can happen even if probably you take plenty of water, you take fruits, but still have the constipations, diarrhea, blood in stool, narrowing of your stool, it becomes a little bit narrowed. Anemia, which is because of having blood in stool, so this means there's blood that you keep losing often. Tender abdomen and abdominal pain. So if there's any touching or palpation of your abdomen, you always feel pain and uncomfortability. Unexplained weight loss and weakness and fatigue. That is just you feeling sickish. How to reduce the risk of this colon cancer? We say, of course, daily exercising, fighting obesity, quit smoking, cut red and processed meat. Of course, red meat is one of the highest cause of colon cancer. So we say if we can cut or at least reduce, it will be much better. Take a lot of vitamin Ds, eat fiber-rich food, That is the fruits, whole grain meals. These ones are putting you at a lower necessary antibiotics. We have people today, they'll have a cough, they'll go buy antibiotic. They'll have an abscess, they'll go buy antibiotics. So this is very bad. And not only cutting unnecessary use of antibiotics, but also we need to learn to make sure that if we are given antibiotics as a dosage, say you are found with a certain disease that needs antibiotics, then we make sure we finish the entire dose. Not that you take a dose today, you feel better tomorrow, and that's where the medication or treatment ends. So you avoid unnecessary use of antibiotics, but then if you have to use them, you make sure that you finish the entire dose. Eat cancer-fighting foods. This is where we go back to the roots of eating the natural foods like the gingers, the broccolis, fruits, all these things that fight cancer. But also you need to make sure that you eat according to your health. For example, we have people with gastritis. Maybe ginger might not be a good natural remedy. So also make sure you talk to your medical personnel to make sure that you eat these cancer-fighting foods that suit your own health. And then drink less of alcohol, but if you can stop, it will also be a greater way of lowering the risk. But also we say regular screening. For colon cancer, we do screening from the age of 50 and above. So in Tanzania, like you could see on this presentation, the number one leading cancer is cervical cancer, followed by breast cancer. Number 3 is prostate cancer. Number 4 is esophageal or esophagus cancer, and number 5 is colorectal cancer. While every other cancer that you know in the worldwide falls at number 6, and they subdivide. So the biggest and the most scary, of course, is cervical cancer for us women. And this is something that is really important that it should be considered by all. Cancer, like I said, treatment is always radiation, surgery, and chemotherapy. So we have people who might go through all these treatments at once. We have people who will go through 2 of the treatments, depending on the type of cancer, the stage of cancer, and the severity of the disease. So if now the treatment is not there, we always go to the part that we don't like most. But then in our country, in the setting of our country, we see this as the biggest problem, because most of the people come the later stage and we end up just going to palliative care. Of course, they'll also get the chemos, the radiations, and the surgeries, but then because of the stage they are in, it's more or less of a palliative. So this is where we say it's very important to just go through the 4 things that are very important. And these ones we do for both the patient and the relatives. That is, physically, we make sure that the treatment for the patient is given, but then those who are also taking care of the sick or the cancer patient are physically made sure that they are okay. Spiritually, this is to make sure that they don't have guilt or remorse, maybe because of their lifestyle or negligences. So whatever happens, you just help them spiritually to just get through it. And this is where we also advise for people to just go to whatever spiritual belief they have and just find peace with themselves. Emotionally, to adjust to the disorders, the anxieties, the frustrations. Also, this one is given to both the patient and the relatives. Then also socially, just making sure that you don't make them feel like they've lost their role, especially for the patients. If he was the father, make sure at least he's seen that he can still have the role as a father, the role as a friend is supposed to do. So this basically palliative is just what we do, or what we make sure that a cancer patient or a relative that is taking care of a cancer patient is intact mentally, to make sure that he or she is ready for anything that will happen. Of course, most of the times you'll have cases where you'll be told with this type of cancer, it will take you maybe 2 years or 2 days. But then again, we are just doctors, and it's important to make sure the patients and the relatives know, but then we leave it also to God, according to our spiritual beliefs, that it's important that they know and they are ready for this. So this is what actually palliative care really does. And as much as I don't like saying this, we have a lot of cases of cancer patients who come to the hospital and it's late, and most of them, as much as they get treatments, we know they're already at the palliative care, because we don't normally do screenings and all that. So most of us go to the hospital when it's already late. So let me not speak so much. This is where I welcome you for questions and whatever you have, and the doubts, the myths, and everything, so we can help each other. Hello.
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 Are we? Yeah, okay.
Oh, you can go ahead, Lucy. I had a question, of course. It will come after you.
No, please go ahead.
Okay. Thanks, Doctor, for the well-elaborate presentation. I have one question. My question is there a risk if one takes in, say, hot food that has been covered in a plastic material, or maybe taking a hot drink that has been taken from a plastic cup? I'm asking this question because I've heard people saying that by doing this practice, you actually maybe digging your own grave. Maybe in future, you might contract cancer. So I just wanted to seek your clarification on that one.
Thank you so much for your question. We had a belief differ in how they are being manufactured. So there was a time that the question or the raised concern was some of the plastics that have been manufactured are not maybe. This goes even to what we put in the microwave. They're not meant to withhold heat. So if you put something hot, some of the materials that were used to make that specific utensil you're talking about, it could be a plate, it could be a container or a cup, would yeyuka, and then when you take, means you're ingesting them, and that could be something that inside the body might cause harm. So that was the biggest concern, and this is where now the entire as a government probably, and everyone that are concerned by health, make sure that if something is manufactured, then has to be at a standard that is the standard that is health conservative. And that's why now most people would say now, just to be safe, not knowing where you're getting or you're buying or the quality of the utensils that you have, then you would reduce using anything that is from plastic. But then if you're sure the plastic that you're using is of quality, then it's not a problem. But then if you're not sure, make sure you always use something, or if it's written, something that is written, maybe this is microwave friendly. That means even if you use it kupashia and something, the food is hot, it's not a problem. So for you to be safe, or because you're not sure, then yes, would say don't put a plastic thing in a microwave, or probably don't put something so hot in a plastic utensil, because if its material can melt and you might ingest it, it might probably lead to, and that will be the most probable cancer would be the colon cancer.
Okay, thanks very much, Doctor.
Doctor, adding on to what my colleague asked, there are some people who say that even bottled drinking water, it is not safe to drink it if it's been sitting in the sun or in a hot place for a while. for the same reason that the plastic of the bottle might melt and contaminate the water.
That is less likely because.
I'm sorry, I can't hear you.
Hello, can you hear me there?
A bit. Yeah.
Okay. I'm saying that
I think we can't hear, Doctor.
Yeah, I think, yeah, I think we're all having trouble hearing you. It's just all of a sudden, before we could hear you clearly.
And now?
Faintly.
No, I'm not sure.
Yeah, yeah. Let me call her from her phone. Let's see.
Hello, can you hear me?
Yes. Yeah.
I was saying it is less likely to have even
oh,
if
your voice went
whole day. It I think it was telling me, and I'm using my phone. Can you hear me now?
Well, I'm having difficulty. I'm not sure if I'm the only one.
No, you are not. I cannot hear as well.
We can't hear.
Yeah.
Martha.
Hello?
Can you hear me?
Okay,
No,
you're
Doctor.